Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us today is Dr. Deena Hinshaw, Chief Medical Officer of Health for Alberta, as well as Dr. Mark Jaffe, AHS Vice President and Medical Director for Northern Alberta. Dr. Hinshaw will provide a brief update, and then we'll open the floor to questions both in person and on the phone. I'll now turn it over to Dr. Hinshaw.
Thank you, Tom. Good afternoon. Thank you all for coming. Since yesterday, we have confirmed 27 new cases of COVID-19. This means that 146 cases have now been identified in our province. We suspect up to 8 of these cases are community transmission, although we have information only on 7 and are waiting for confirmation of the 8th. 2 individuals are receiving care in ICU, which we have announced previously. I must also sadly report the first death from COVID-19 in our province. This individual was admitted in the ICU in the Edmonton zone on March 12th and passed away late yesterday. This patient was a male in his 60s with underlying medical conditions. This is extremely sad news, and all of us involved in Alberta's COVID response feel this very deeply. All of our thoughts are with this man's family and loved ones. AHS assures me that they are supporting them in this difficult time. As heartbreaking as this news is, it was expected. This is a dangerous virus. While most people who become ill with COVID only experience mild symptoms, it can make others very sick. We only have to look at other countries to see how serious it is. It has been reported that Italy has just surpassed China on COVID-19 deaths. I know that this news is frightening and will add to people's anxiety. We are doing all we can to fight the spread of this virus. This is why we have taken the extreme measures we have. We will get through this, but to do that, we need everyone's help. Take this seriously. Stay home unless it is essential for you to go out. Now is not the time for social gatherings. Practice social distancing if you do not have to go out, including if you have to work outside the home. Sorry, let me say that again. Practice social distancing if you do have to go out, including if you have to work outside the home. If you are struggling with today's news, reach out to friends and loved ones and talk. Tell them how you are feeling. Today's sad news is precisely why we are taking aggressive measures to reduce the spread of COVID-19. The restrictions we have put in place on mass gatherings, the closures of public recreation facilities, and the limitations on restaurant capacity, these are all efforts to protect the public's health and prevent spread. I urge you to take these measures seriously and do your best to limit your social interactions and practice social distancing. To assist Albertans, we have launched new resources online on social distancing to try to make things easier. If you were wondering what steps you should take while grocery shopping, riding an elevator, or going to a restaurant, go to alberta.ca/COVID-19 and click Help Prevent the Spread in the Prevent and Prepare section. Some social distancing tips include shopping during off-peak hours, like first thing in the morning or late at night, wiping down baskets and shopping carts before and after using them, sanitizing your hands when you get off the bus or train, using utensils if you are eating out rather than choosing finger foods, and avoiding open snack dishes such as peanuts or candy. These are simple tips that can help us all flatten the curve and prevent the spread of coronavirus. I have heard concerns about compliance with the public health orders we have issued to close certain facilities and limit the capacity of others. If you have concerns about an establishment, please do not call 911. I have been hearing reports of this happening, and we must leave this line open for true emergencies. We are working with Justice and Solicitor General to develop a process for responding to these concerns, and we will provide an update when we reach a solution. I want to again extend my condolences to those who are grieving the loss of their loved one due to COVID-19 today. We have put aggressive measures in place to prevent the spread of this deadly infection and protect those who are most vulnerable to make the number of these tragic occurrences as small as possible. These measures are hard on all of us. I urge you to take them seriously. We must continue to stand strong together even if from a distance. Thank you for coming, and I'm happy to take questions.
Deena first.
Doctor, are you providing any more details on the person who died, for example, if they were part of the travel cohort or what the underlying medical condition was?
We won't provide any additional details on what the underlying medical condition was, again, wanting to limit information on individual identifying information. But unfortunately, this individual is someone who did seem to have acquired the disease in the community. We were not able to find any travel linkages or close linkages with a confirmed case.
Can I follow up with, I think you've been made aware of the Saskatchewan Health Minister, I think, has been infected from a bonspiel here in Edmonton. Can you tell me more about what's happening there and what's been done with the doctors who went to this event?
So first thing this morning, I was notified of this issue by Saskatchewan. And so it's the president of the Saskatchewan Medical Association is the information that I have, who attended Western Canadian Doctors Curling Bonspiel that was held in Edmonton late last week through to the weekend. At that time, Thursday through Saturday, our restrictions on mass gatherings were between all cancelled over 250, and any gatherings between 50 and 250 that had critical attendees should be cancelled. Anything less than that could go ahead with social distancing measures. So again, I want to remind all of us that although we've taken additional measures since then, at that time, there was no specific restriction other than our guidance to make sure that social distancing was practiced. So we do know that there were approximately 72 curlers. I'm not sure that they were all in the same place at the same time. And then there was a banquet that had about 45 attendees. That's the information that I've been provided with. But we know those doctors came from across Western Canada. And so we're working with the organizer, with Saskatchewan, to make sure that all those doctors who attended that bonspiel are aware that there now seems to have been transmission at that event. It seems the index case may have been someone who came from Las Vegas and attended that event. And so we're making sure that all of those who attended know that they need to self-isolate for 14 days. And we're getting a list of contacts from the organizer, and then each province that has affected doctors will be following up with those people.
Well, there's different events. This is when you go curling, everybody is literally touching the same part of the same rock for 3 days. Does that give you some concern about what might come out of this bonspiel?
Well, I absolutely say that anyone who attended that is needing to self-isolate for 14 days because clearly there was transmission at that event. And so we are taking this very seriously. And again, we'll be making sure that we follow up individually with attendees. But as this information just came to us today, we're working through that right now.
Yeah.
How does that concern you in terms of like the doctor workforce here in Alberta? You could be losing doctors for 2 weeks. How critical and how concerned are you about that?
So certainly it's something that I'm mindful of that could have an impact, and we won't know more until we do that investigation about where those doctors came from, what their specialties are, if there are others who can cover for them. So all of that information will be coming as that investigation unfolds. And again, all I can say is that it is concerning and we're taking it seriously and we're doing the investigation.
Yeah, one
Sorry,
follow-up.
more. As for the death today, you said it was heartbreaking but expected. How many more deaths do you expect in Alberta? Do you have an estimate or?
It's very difficult to say. I think, you know what, it all depends on how we can all collectively prevent spread, flatten that curve and make sure that we're limiting the transmission of the virus. So I don't have a specific number, but again, my goal is to keep it as low as possible.
Yeah, Julia, and
Are any of the cases that we have confirmed in Alberta linked back to that bonspiel at this point?
Not that I'm aware of. I'm aware of, again, an index case that was identified in Saskatchewan who had traveled from Las Vegas, and then another case in Saskatchewan who seems to have acquired it at that event. But again, we just got this notification today, so we'll be doing follow-up.
And I also just want to ask, we've been talking about when we can expect this peak. What does the peak look like in terms of how many hospitalizations there might be?
Again, it's a difficult question to answer, and again, kind of goes back to that total number of deaths question. That depends on us. The total number of hospitalizations, the total number of deaths, the total number of cases, that depends on us, all Albertans working together to limit the spread of this virus, doing all of the things that I've been talking about, that many are talking about with social distancing, following the guidance and the orders that were issued. So the total number of hospitalizations and deaths, it's up to us to keep that low.
We're going to go back to the phone. I know there's questions here. Operator, could you patch through the first question, please?
The first question is from James Keller with the Globe and Mail. James, your line is open.
Looking at this bonspiel event, I mean, we had over 70 people. It was an international event because there was someone from Las Vegas, and we're talking about critical personnel. I'm just wondering, wouldn't this have fit in the restrictions that were in place at the time? And what does it say about the numbers in terms of, even if it's 40, 50, is that a small enough number to adequately do what we're trying to do here with social distancing?
So it's a difficult question without knowing the circumstances of exactly how many people were in one place at the same time. It's hard for me to comment on whether or not it would have fallen above or below that 50 as a gathering. I know the one piece of information about the banquet that happened was 45 people. Again, our recommendation at that time was if events were to proceed, they should be with social distancing, hand sanitizer, ensuring that ill people didn't attend. And I want to be clear that the individual who we believe was potentially the introduction of the infection into that setting wasn't necessarily from Las Vegas, was from Saskatchewan, but had returned from a trip to Las Vegas. So again, I think what the lesson learned from this, first of all, we've already reduced our restriction to a number of 50. And any events that happen even below 50 that have people who are at high risk of severe outcomes from disease, critical infrastructure, or those who came from, and again, we probably need to be clear that it's not just someone who lives internationally, but someone who's recently traveled internationally, that those events should be cancelled even if they are less than 50 people. So again, whether or not this would have met our definition of restricted events probably depends in some part on the details, but it really shows us that even with smaller numbers of people, you can get significant transmission, and we'll have to watch closely to see how many additional cases we get out of this event.
And then a quick follow-up, just back to the fatality we have. Can you tell us anything about this patient's underlying conditions?
So at this time, we're trying to balance the patient confidentiality with the public's right to know critical information about this rapidly evolving situation. And I think, again, at this point, we know information from China about the kinds of conditions that cause severe outcomes. So those are things like hypertension, diabetes, having a heart condition, having a chronic breathing condition, and then again, older age, so particularly over 80, but even older ages, 65 and over, can have severe outcomes. And so I think that information is relevant for public health in terms of knowing where the risk factors are. And this particular individual, again, didn't have all of those conditions, but had some of them. And we're not disclosing the particulars to try to prevent inappropriate identification of an individual.
Operator, could you patch through the next question?
Next question is from Jason Herring with the Calgary Herald. Go ahead, Jason.
Hey there, Doctor. Hey, Dr. Hinshaw. Hoping that you can talk a little bit about this report of a attendee at the Pacific Dental Conference who's refusing to self-isolate.
So I wonder if I'll turn that over to Dr. Jaffe, as I believe Alberta Health Services was notified and has dealt with that.
Thank you, Dr. Hinshaw. So we became, at least I became aware of this a little bit earlier today. We were informed at Alberta Health Services on March 16th by an anonymous call that an individual who had attended that conference was not self-isolating as we would hope that they would. So again, that information came to us on March 16th, but there was insufficient information for us to be able to follow it up directly at that time. We have worked hard since receiving that information, and today we're able to contact the individual who had been identified. We've been able to be in touch with that individual, and they are now self-isolating.
Operator, could you
Quick
patch?
follow-up if I could.
Go ahead.
Sorry, the next question is from Emma Graney with the Globe and Mail. Emma, go ahead, please.
Yeah, g'day. Thanks for taking my question. I did have a quick follow-up after this one. So for those folks who are not following the self-isolation guidelines, particularly those who are coming back from the USA, you said don't call 911, which is great advice. But what should we do? Should we, publicly name and shame them? Should we be telling AHS? Like, what is your advised course of action now? I've gotten a lot of questions.
So we are working with Justice and Solicitor General on processes for enforcement of all of our public health measures. And so part of that will include advice on who to contact when somebody observes whether it's a business that's not shutting down or somebody who's not self-isolating. So we will provide that information very soon. I know that members of the public are interested in knowing that. In the meantime, I would advise if you do see somebody who's not following the recommendations to make sure they know how serious this is. Again, these measures save lives, and it's really important that people understand this is not to be taken lightly. If they need supports to be able to self-isolate, then that's something that, again, through local networks to try to find out what are the barriers to them staying home and whether there's any supports that can be put in place. And again, I think the critical thing is that we not take vigilante action against individuals. We provide that information. Soon we will have the ability to let people know where they can report it. But in the meantime, please do not call 811 or 911 as those aren't the proper places to report those concerns. We will have an avenue for that very soon. But in the meantime, I think the best advice I have is just to encourage those individuals to do the right thing and remind them how important it is.
And you had a follow-up there, Emma?
Okay, and then, yeah, my follow-up question relates vaguely to this. Obviously, going to be shutting the USA border, US-Canada border. With the number of cases that seem to be coming from the US, we've of course got the case from Las Vegas. How important is that border closure, do you think?
So I believe that it is very important. My understanding, again, this is a federal matter, but I understand that there's been negotiations to try to have a mutual agreement to limit non-essential travel back and forth. But I believe that it is essential that we limit movement. We certainly see the numbers in the U.S. increasing. And so I think, again, my advice to people is stay close to home at this time. Again, we've already said on multiple occasions that unnecessary travel should stop. And I think that that closure or that limiting of movement will be a very important measure in helping us reduce our case counts.
Julia, I believe you had an next.
Today the mayor held a press conference about resources and help for the homeless and the vulnerable. He expressed some frustration that help isn't coming fast enough for the homeless, that there's a lot of red tape for at least the city to have to deal with. How do you respond to that?
So finding accommodations for the homeless population, especially if some of those individuals are feeling sick, is a top priority for government. And I have the privilege of standing here and talking to all of you, but you need to remember that there are teams behind me. There are so many people working tirelessly to move our response forward. And there are teams at the ministry who have been working for a long time on this particular topic. There are challenges that need to be overcome. And so sometimes that slows things down more than we would like. But I can tell you that it is a top priority to get appropriate housing for those who are homeless and may have symptoms, and particularly preparing for cases where we may have positive COVID cases in that particular population, ensuring that they have the supports that they need so that they're able to stay in one place and get the care and attention that they need at that time.
Also, just hoping to get a quick update on testing capacity. A few days ago you had said it's at 1,000 and you're hoping to expand that. What are we at now?
So the lab was able to increase capacity to 2,000, and as of yesterday had even gone above that. I don't have final numbers yet, but these are not numbers that the lab can necessarily sustain in the long term. And so we're looking, and I've said this before, it's a challenging thing to try to adjust our lab testing to make sure that we're capturing all the different groups that we need to. As I've said before, we do not have the capacity, and we will not have the capacity in short to medium term to test every Albertan who has a cough or a runny nose. And so what I would say on that front is we are working to get that balance to be as appropriate as we can to make sure that we're testing all of the different groups that we need to find cases in. But at the moment, we are just making sure that we're working through and that we don't have any unintended consequences as we adjust what our testing protocols might look like going forward.
Over to you.
I'm getting a few notes. It looks like the Alberta government COVID site has crashed. Can you talk a bit about the IT work going on behind the scenes right now, or is that something people should be concerned about?
This
would be
new
brand
information.
new.
Yeah.
This is brand new. We'll definitely look into it and get back to you.
My other question, if I can, sorry. We're seeing a lot of things in the news about some people who are asymptomatic but saying they're testing positive. I know you were just talking about testing capacity here, but what can you touch on these asymptomatic cases that people are talking about in the media?
So we know in some places and in some investigations around a particular case, so for example on the Diamond Princess cruise ship that was outside of Japan, as a part of that outbreak investigation, there were some tests done on people who were asymptomatic that did come back positive. But in the literature, in terms of what's published with respect to when people have no symptoms and then test positive, inevitably they go on to develop symptoms at some point. What we don't know at this time is whether or not it's possible or likely to transmit infection without symptoms. We know that in the case series that the independent mission to China put out several weeks ago, the World Health Organization independent mission, their conclusion from their investigation of tens of thousands of cases in China was that asymptomatic transmission was very rare and was not a driver of the outbreak. And in fact, household transmission rates in that case series were approximately 10%. And so I think when we look at all of those pieces of data, even though people may have a positive test, it's not clear how important that is for transmission at this time. And so we are not testing people without symptoms in Alberta. The most important tests we do are those who have symptoms where we believe that risk of transmission is focused.
All right, we're going to go to the phone. I know there's 3 questions, and we'll come back. Operator, could you patch through the next question, please?
Yeah, question from Moira Warburton with Reuters. Moira, go ahead.
Hi. So I know you just mentioned testing. I'm wondering if you can get more specific about the numbers, specifically how many tests are the labs doing per day, not capacity, like how many are they doing?
So we do publish that information on our website, and so there is a daily count of how many tests the lab has done each day. I don't have the exact number in front of me from the last 24 hours, but you'll find on our website again that daily count, and I believe that our totals as of today have exceeded 17,000.
Approximately that. If you email me, we can definitely get you the exact figure after this is complete. Operator, could you patch through the next question, please?
Next question is Kevin Nimick with CTV Calgary.
Hi, Dr. Hinshaw. South Centre Mall in Calgary has confirmed to us that an employee of a retailer at the mall has been diagnosed with COVID-19 after working in the mall late last week. How concerned should patrons and other employees at that mall be?
So I don't have that particular information, so I can not speak to that particular case. Again, individual case follow-up is done by local public health. And so what local public health does in any instance, and if there's somebody who's diagnosed as a positive case, local public health finds out where they were while they were symptomatic, and then from that information determines who might have been at risk and then reaches out to contact those people. So I can't make any specific comments on that particular mall. I know we've had reports that have come through to the ministry, concerns about a particular location and somebody who maybe is a case or not. Sometimes when we chase down that information, it turns out that the person who's being called a case is somebody who has symptoms and is being tested. And again, I don't know what the situation is at this particular mall in Calgary, but I can tell you that local public health is very aggressive in their contact tracing, and they do notify anyone who's been in contact with that person while they've had symptoms. And again, that's another thing that I think is sometimes a misconception. So if you have someone who develops symptoms and then tests positive, sometimes there's fear because someone was in contact with them 3 days before. But if they weren't symptomatic at that time, that person would not be considered to be at risk, as I was just talking about that concern about asymptomatic transmission. So the critical thing in all of these reports is that local public health is following up and making sure that anyone who's at risk is contacted.
Excellent. Could you patch through the next question, please?
Next question is Chris F., also with CTV. Chris, go ahead.
Thank you for taking my question. I have a quick follow-up right after this as well. First of all, Dr. Hinshaw, are you able to confirm that some space at the Alberta Children's Hospital here in Calgary is being set aside and used for adults to make room for COVID-19 patients at other hospitals?
I would defer to Dr. Jaffe. That seems like an AHS decision.
So thank you for that question. As I've mentioned a couple of times in the last couple of days, we have teams of individuals working within Alberta Health Services to identify hospital spaces that can be used to care for individuals who we anticipate over the next several weeks may need to be admitted to hospital for care. That might include space at the Children's Hospital. Again, we know that children are less affected by this virus than adults are. At least they don't become as ill as adults do. So there may be space within the Children's Hospital that could be utilized to care for adults if we are short of space in other settings. Let me take a moment while I have the podium to express my sincere condolences to the family, the loved ones of the individual who has passed away from COVID-19. Our thoughts are with that family. I want to also emphasize our thoughts are with the care team that provided care to that individual over the last several days. You need to understand that this is very tough on our teams. They do everything they can. They work night and day trying to support individuals, hoping to see them recover and leave the hospital. These sorts of events are very, very tough on our healthcare workers, and our thoughts are with them as well at this time. I want to emphasize that we do provide support. We are supporting the family of the individual. We also provide support to our healthcare workers. We're all in this together. We need to support each other. Times will be tough in the next few weeks. We need to be there for each other, and we want to ensure that we are there to help support our healthcare workers.
Okay, just as a follow-up, it's been 2 weeks since our first confirmed case here. How is that person doing? How close is Alberta to having its first person who's recovered from COVID-19?
So I have not been informed whether or not that particular individual has recovered. But what that is a good reminder that we need to make sure that our website is updated with recovered numbers, because it's my understanding that we have at least 2 individuals who are previous cases who have recovered. So again, this is a good reminder that that's something we'll need to add on, because those are those signs of hope that we know that many people who get this do recover. And so we'll make sure that number gets updated.
In terms of the website, we can confirm that the website was down momentarily and a team is already working into it to address it. Final 3 questions in the room I've seen, so start with Dylan.
Yeah, we've received a couple of tips that there's some people working within the healthcare system, more in specialized roles, surgeons and specialists, that are coming back to work after not self-isolating if they've been abroad. I was wondering if you guys have received any of those tips and if there's any comment on that.
So So I think the only thing I would say is that at the ministry, we've been working with Alberta Health Services, following an example that British Columbia set, so that where there is a particular setting where care will not be able to be provided for a particular critical healthcare provider, if they're coming back from an international travel and an entire care team will have to shut down if they're not able to work, that sometimes we can put in place very aggressive measures that that person wears a mask at all times, that they social distance except for when they're providing care, those instances, that they do temperature checks and symptom checks in the morning, noon, and night. And so those would be exceptions that we would consider making, again, on exceptional basis, where we're weighing that trade-off between having someone who's asymptomatic and at home for 2 weeks, having to shut down an entire critical care service, over and against putting some of these measures in place to make sure that if they were to become symptomatic, first of all, they wouldn't show up to work, or if they did become symptomatic, immediately they would stop what they were doing and leave. And so that's the only thing I would say that we're working with Alberta Health Services on. So those particular individuals may get this exemption if they do all of those particular measures. But other than that, again, I would look to Dr. Jaffe, sounds just to say if he knows of any specific instances.
Sure, one more follow-up.
In relations to the individual from the dental conference that was refusing to self-isolate, are there any measures that can be taken, I don't know if it would be legal or what have you, on people that are refusing to self-isolate, to get them to self-isolate?
So again, I mentioned the work we're doing with Justice and Solicitor General, because the measures that we've put in place, there are legal force and action to many of those measures. And so what we're looking at is the mechanism to make sure they're enforced. With respect to healthcare professions, I am meeting with the professional colleges and associations next week. And one of the things that I would be encouraging them to do is to make sure that their members are fully aware of their professional obligations, which do include following all guidelines and measures from public health, because there's a piece of legal force in action, but there's also that regulatory authority that colleges have over their members. And so I think we have multiple mechanisms to make sure that these guidance is being followed.
We're seeing more communities in the United States start to put in shelters in place. We're seeing other provinces encourage anything that isn't an essential service to shut down. I know we have measures in place right now in our province, but are we getting to that point where we need to be telling people to shelter in place, or for all retail businesses to be shutting down?
You know, all of these questions are questions that we look at every day. Are we at a point where we need to consider further closures, further restrictions? It's always a difficult balance between making sure that Albertans have the goods and services that they need. We know that putting people out of work has a huge impact on their health. And so where we feel that some smaller businesses can continue to operate safely, we're continuing to allow them to do so. But again, measures to protect the public's health are constantly being evaluated. And if we were to see acceleration in community spread or an indication that risk had increased, then those are, again, things that we may consider. But at this time, we're really trying to find that right balance between ensuring that Albertans have what they need and that can continue in safe ways their daily business while taking these measures to protect the public's health.
Final question? Oh, sorry, real quick.
You had mentioned yesterday that there would be an update on whether there will be any exemptions for daycares to operate for the families of essential workers. Is there any update on that?
So we expect to have that finalized by end of day, but I don't have final information on what that would look like. It is, again, something that we know is top of mind for many parents who are essential service workers, and again, the impact on essential services when both parents are working and again in critical service areas and they have no childcare provisions. So again, that's another priority that we're working on today, but I don't have more information about what the outcome of that would be.
We will be doing another update again tomorrow.
Could you speak to the severity of this virus, considering a fella came into contact with someone who had it about a week ago and now he's dead?
So the virus can be very mild for some people, and for others it can be fatal. And so I think that's part of the challenge that we have, is that when people hear statistics like 80% of people who get the virus have a mild self-limiting illness, I think for some people that fact is something that sticks in their head as a reason to not take it seriously. But the challenge is that even for those people who might have a mild self-limiting illness, if they spread it to others, then even if they themselves aren't directly impacted, they could be impacting others. And we can't tell for sure. We know that people who are older, have medical conditions, have higher risk of severe outcomes and death. But as I've said before, sometimes younger people can still have severe outcomes and death. So this is not something to be taken lightly. Yes, many people who get it will have no more than sort of a mild cold, a few days of fever. But if they spread it to others, that chain of transmission can cause deaths, ICU admissions, hospitalizations. So again, we're all in this together, and this virus should not be taken lightly.
Excellent. Thank you all for coming. We will provide another update again tomorrow.